Hi, good evening, everyone. Tonight is our weekly Thursday talk. We have the amazing Dr. Jerry Chin here to share with us and to inform us with his knowledge about indigestion, gastric, constipation, and other digestive issues.
Good evening, Sam. Thanks for the intro. Dr. Jerry here, our Thursday 8 o'clock health talk. Today, I want to talk about a fun topic that we all like to talk about, which is eating and food. I think for everybody, eating and food has become a very pleasurable event, very social. We like to have fun. But I'm sure all of us have experienced some digestive problems after that. For example, indigestion or gastric pain or even constipation, or some people even, throwing up and things like that. So I want to cover those topics tonight. Going back to the basics, we all need to know why we need to eat, right? We need food to survive. We need the nutrients from food that we need for essential life. So last time, we need to eat to live. But I think today, most of us live to eat. And we are eating all the time, sometimes many times a day, sometimes a lot. And that has led to a lot of problems, which I covered the last topic on metabolic syndrome, which is diabetes, high blood pressure, cholesterol, heart diseases, chronic diseases. These are all the results of very poor dietary habits. To help absorb the food that we eat and to provide the nutrient absorption that we need, our body has something called a digestive system. In some books, it's known as the alimentary canal, or it's known as the GI tract, which is the gastrointestinal tract. All this is part of our digestive system. There are two main parts. The first part is the digestive tract, which is our hollow canal. It's a hollow organ, like a pipe, that goes from our mouth to our throat all the way down to our anus. It's like a tube that goes through, and that's our digestive tract. So whatever you do, there is one way of intake, and there's another way of coming out. And that's our whole digestive canal. And it's important because as the food gets broken down, nutrients are absorbed along the way so that we can have a healthy life. Now, I mentioned absorption. To support our digestion, we have a few supporting actors. Like in a movie, you have all the supporting actors. So what are the supporting actors? Very important. Of course, we have our salivary glands, which is in the mouth to produce saliva. We have the liver, we have the pancreas, we have the gallbladder. So all these produce enzymes and different digestive juices that is needed for the food to be absorbed. Now, if anything interferes with that canal, with that digestive tract, or interfere with the function of those supporting actors, then you have a digestive problem. Let's start with one of the most common problems, which is indigestion. I'm sure every one of us have experienced indigestion at one time or another. So what are the symptoms? You have a burning sensation in the upper stomach or in the stomach, which we call heartburn. You can have pain in the abdominal, we get bloating, feeling of fullness, belching, burping, a lot of gas, sometimes even nausea and vomiting. And you also have a feeling of an acidic taste in your mouth. So all these are signs of indigestion. Well, there are three main causes of indigestion. The most common one, number one, is our lifestyle. Number two is also the medication that we take. And number three, you could have a more serious underlying disease. Out of the 1, 2, and 3, I'll cover 2 and 3 first. Number two, medication. If you take a lot of painkillers, oral contraceptive for birth control, steroids, some kind of antibiotics, or even if you're taking some estrogen or hormone tablets, all these can cause indigestion. Which is why when you take certain pills like aspirin or antibiotics, the doctor will always tell you to take it together with food or after food, not on an empty stomach. If you have very bad indigestion all the time, then you should have it checked out by the doctor, because it could be a sign of an ulcer, a reflux disease, or even gallstones in your gallbladder. It could even be stomach cancer, or some problems with your liver, or some problems with your pancreas, or even a thyroid disease. So all these could be underlying diseases that you should watch out for if your indigestion happens all the time. But remember that the indigestion is not caused by excess stomach acid. A lot of people have the misconception, but it's not caused by excess stomach acid. Well, coming back to the number one cause for indigestion, usually it's lifestyle related. For example, the wrong kind of eating, wrong kind of food, wrong kind of eating technique, a lack of enzymes. Stress and fatigue also can cause indigestion. Too much alcohol, inactivity, lack of exercise, lying down after food, or even pregnancy can cause indigestion. In terms of lifestyle, I always tell people the easiest way to overcome indigestion is to control your diet. The first thing is to eat smaller meals. Eat 50% of what you normally eat. For example, having half portions or sharing portions is good for your pocket and also good for your health. You don't have to spend so much. And having smaller meals also mean that you can eat more. So if you enjoy food, maybe that's even better. So the number one thing to do is to have smaller meals. The number two thing, most important of all, is to chew your food slowly with your mouth closed. Why did I say that? It's because if you trap a lot of air as you eat, you will cause indigestion. So therefore you need to chew more times, don't speak or don't talk, and keep your mouth closed and eat slowly. These few things will help you prevent indigestion. So number one was smaller meals. Number two is chew more, mouth closed, don't talk. Number three, do not drink a lot of water. I see a lot of people drinking a lot of water when they're eating. This will dilute your digestive power, your digestive juices. So it doesn't help your stomach to digest. And I find that the reason why people drink a lot of liquid, a lot of juice, a lot of cold drinks when they eat is because they eat food that is too salty, too spicy, or just too much flavor. So therefore we keep drinking water, and that's really bad. So we should avoid oily food, fried foods, and overly spicy foods. And of course, too much alcohol and too much smoking will also weaken the digestive system. Another thing we should do while eating to prevent indigestion is to focus on eating, to relax, to not be stressed, not on your handphone, not watching the TV, not talking to people, not scolding on the handphone. These are the things that lead to indigestion. Now, eating good food or eating food is a moment to enjoy. It's a pleasure. So you have to be relaxed. So therefore, your stomach is relaxed and your stomach can do the job for you in a relaxed fashion. Another thing you should avoid is eating foods that are overly hard, deep fried, or grilled until it's very dry, because that will give extra work to our stomach. We need to eat foods that are softer. Now I want to talk about the technique of eating. We need a lot of enzymes to help our food digest. So therefore, we should eat fruits and vegetables on an empty stomach before food, not after food. All fresh fruits and vegetables should be eaten on an empty stomach. It will help us digest food, but we cannot eat it after food. So the right timing for food is to eat fresh fruits and veggie first, some soup, and then carbo, and meats should be last, because meats take the longest to digest, 3 to 4 hours in your stomach. So if you eat the meat first, it will block your digestive system from other foods going through. So therefore, it's best to eat meats last. Unfortunately, I find that this is an advice that very few people can follow, because when I go for dinners, I see that people will just eat the meat first. So my advice to these people is, it's okay, pick up the meat, put it on your plate, but don't eat it first. You can eat it afterwards. Now I want to come to the second point on gastric, which we are covering tonight. It has a lot in common with my explanation on indigestion in terms of what causes the gastric. But aside from that, there are other causes. Besides eating habits, there are 3 other causes that can cause gastric. For example, you may have a bacterial infection known as H. pylori. This is a bacteria that resides in your stomach, and you can have it tested at the lab. The other thing is you may have an ulcer. An ulcer is basically a puncture or a tear in your stomach lining. It could be a small, it could be serious, causing you a lot of pain, and it could be an inflammation of your lining also, your stomach lining. If you suffer from gastric for more than a week, you should really go to the hospital and have it checked out, because you could have a very bad ulcer, or you could have a bad inflammation of your stomach lining, or you could even have the bacterial infection, as I mentioned before. I'm not sure whether all of you know this, but for your food to digest in your stomach, you need acid. So acid is actually your friend that helps you digest the food. Otherwise, the food will not get digested. But to prevent the acid from burning your own stomach lining, the stomach has a defense system. It produces a mucus lining, something like an alkaline buffer that protects the lining of the stomach from being attacked by your own acid. That is why it is important to eat slowly, because you want your saliva to come out and you want the signal to be sent from your brain to the stomach to say that food is coming, so that the stomach can prepare itself, can form the protective mucus lining, so that when the acid come out, it doesn't burn your stomach. As for indigestion, stress also causes gastric. You will find that a lot of people, when they're under stress from work or from any personal reasons, they will suffer a gastric attack. Therefore, it is important that you must learn techniques for de-stressing, whether it's through deep breathing, or you're buying a stress ball which you can squeeze with your hand, or just practicing certain kind of meditation techniques that can take your mind away from the stress. And it's not a good idea to have a big meal when you're stressed. It's important to have very soft food and very light food when you feel stressed. To help your gastric, you should have bigger intake of things like ginger, turmeric, and of course probiotics, which include kimchi, yogurt, miso, kefir, things like that, that provide all the good bacteria that your body needs for good digestion. Now let's talk about constipation, which is the inability to go to the toilet. Constipation for some people could be 2-3 days without going. I've known people who haven't been for 1 or 2 weeks. I've even come across a case where they haven't been for 1 or 2 months, which is really, really extreme constipation. Once in a while, you can use a laxative, or you can use an enema pill to help relieve the constipation. But if you keep using it, you become intolerant to it and you will have to depend on it, which is really not a good thing. If you follow proper eating habits, you should not be able to have constipation. You should be able to go to the toilet and have a bowel movement at least once a day. Some people do it twice a day. And for most people, once a day is good. What causes constipation? Number one cause is a lack of water, lack of fiber in your food, lack of enzymes to break down the food that you have, a lack of exercise, and irregular hours of eating and going to the toilet. You should try to stick to a regular hour. Or even a lack of good oil intake. You need to drink at least 8 to 10 glasses of water throughout the day. Okay, if you don't consume at least 8 to 10, then you could be prone for constipation. And you need a high fiber intake. Fibers come from fresh fruits and fresh vegetables. But if you find that you're unable to keep up with 3 to 5 helpings of fruits and vegetables, you might want to consider adding something called psyllium husk or oat bran in a big glass of water. You can get psyllium husk or oat bran in the organic shop. And most importantly, when you take these things, maybe 2 tablespoons in the morning, mix it with a glass of water, and also drink another glass of water after you have taken it. You need to take psyllium husk and oat bran with water. Otherwise, it will dry up and may even cause constipation, which is what you don't want. It is very important to take enzymes every day, and enzyme comes from uncooked foods, fresh fruits, fresh vegetables like salad, papaya, pineapple, apple. You need to take at least 1 or 2 a day to prevent constipation. Coming back to the beginning, the reason why we eat food is to provide nutrients that we can absorb. Okay, so we need high nutrient value and we need high absorption. Unfortunately, today's food are very low in nutrient, and also it doesn't get well absorbed because a lot of the food are processed. So in today's world, it is important that we take a good supplement. If you have a poor lifestyle, you should take more. If you have a very good healthy diet, then maybe you take less. Now, as you know, Soplus has all the nutrients equivalent to several helpings of fruits and vegetables that is good for you. We need to take something like that is highly absorbable, because the nutrients are made into very fine molecules that can be easily absorbed by your body. Therefore, I always advise people, when you're taking Soplus, don't swallow too fast. Take it slowly, move it around in your mouth, and let it absorb through the blood vessels in your mouth. Hi everybody, sorry about that. My battery kind of died, but actually that was the end of my presentation. So for good health, make sure you take good supplements like Soplus, and at the same time, please play back my advice on how you should eat to prevent all these digestive problems. Good night everybody, and thank you, Sam.
Thank you, Dr. Jerry. That was a wonderful information sharing. Anybody have any Q&A to ask Dr. Jerry?